What are the symptoms for those who do have symptoms?
Yeah, generally the commonest symptom is actually bleeding. So a lady will start, her periods will start getting heavier and heavier, and usually also last longer and longer. So if she was having periods for 3 days in a month, they start going to 5 days and then 7 days, and then they get heavier. So she has to use more and more pads per day for the bleeding. So that's the commonest symptom, and of course it would cause anemia, because as she loses more and more blood then she gets anemic.
Okay.
Other symptoms are not as common, but they can get pain. They can have a feeling of pressure in the pelvis. It may cause issues with the urine, because the uterus with fibroids presses on the bladder. So a lady may find she has to go to the toilet to pass urine more frequently. So those are the main ones. Sometimes, because of the location of the fibroid, they may have be attached to a cord, to the uterus with a cord, and that cord may twist. So at times again that can cause severe pain. In some ladies, the fibroid may be within the womb or within the uterus, and then it prolapses or comes out through the birth canal. So then she starts having a growth coming out through the birth canal.
Okay. Now you mentioned that one of the symptoms is heavy periods, and I'm sure there are probably other causes that could be linked to heavy periods, which may not necessarily be fibroids. Is there a distinct difference between when the periods are heavy, when it's fibroids, as opposed to other things? Is there a way you can differentiate and say this is actually fibroids, or it could just be a general?
Yeah, usually what we would do is examine the lady, and if the uterus is enlarged, then we would probably think it's fibroids. There are, as you say correctly, that there are other causes of heavy bleeding. For example, she may have a problem with clotting, blood clotting. So the way if somebody gets cut and the bleeding doesn't stop for long, is the same way this lady may bleed for a longer time, yet she doesn't have fibroids. So if we would examine if the uterus is enlarged, that could be fibroids, and then we would also do an ultrasound, which usually would now determine or define exactly what is causing the heavy periods.
Okay. So once one has identified that maybe they have this heavy flow that is unusual, what should the next step be for them to prove that it's actually fibroids?
Oh yes, they need to be seen as soon as possible, and then we would now examine them, check the size of the uterus if it's enlarged, and then also do an ultrasound, and then make plans for treatment depending on the specific situation that she's in.
Sometimes medical care is very expensive, and you know, when you talk about ultrasounds and one having to visit a doctor, sometimes it sounds like it's a very technical kind of thing. Is it something that, you know, your local GP can identify? And secondly, are there some ways that you can actually tell, even before you go to the doctor, that you know, chances are that these are fibroids?
Yeah, the local GP would definitely be able to diagnose that the lady has fibroids or not. The lady herself, it may be a bit difficult for the lady to know what. Yes.
Okay.
So the GP would examine and then probably still send for an ultrasound. The reason why we have to do that is to really know what is causing the bleeding, because most of the treatment is actually surgical. We need to perform surgery, and so we need to perform surgery when we are 100% sure that we are dealing with fibroids and nothing else.